So I'll just introduce you briefly, and then maybe we can start the session. Um, am I audible? Clearly audible? Huh?
Yes.
Okay, nice. Yeah. Okay, so good afternoon, everyone. Sorry for the technical glitch. I think the link which was sent first didn't work, and then now we are having this new link. So I hopefully some other people will also join. We can start the session. As you all know, this is what we call exchanges in primary care. It is a fortnightly series which we do twice in a month on first and third Saturday of every month. Basically, it is a very informal platform where we want to bring people who are working in primary care together and share learnings and from each other. And we also want to keep it as an open space where people can share ideas which may not be fully tested, which may not be proven to be effective, which are in on the drawing board, or which are in the pilot test, so that people can share it with others and get inputs from others. So this is a very informal platform, as many of you who have been joining in the past would know. Yeah, that is the brief about this session. Now, today we have Dr. Arjun Jakasania from MGIMS Wardha. He's an associate professor in community medicine over there, and he is also in charge of the Rural Health and Training Center. As people might know, MGIMS is slightly different than the other medical colleges. It has a strong rural orientation, strong community outreach, and which is reflected in their education, in their projects, and their research. So Arjun is involved in a lot of field-based research projects linked with ICMR and other organizations. So today is here to talk about one of their important initiatives known as Sahjeevan, coexistence, where they have tried to address the issue of elderly care through a very non-medical lens. Because since we are associated with medical institution, most of the times what we end up doing is seeing it as an illness, trying to treat it, trying to provide medicines for that. But today we'll try to see how we can address this issue from a more of a social or non-medical point of view. So I think without wasting much time, I will hand over the mic to Arjun, and let us hear from him. So we'll have around 40 minutes or so of presentation by Arjun, and then we can have a discussion with him. So Arjun, over to you.
Sure. Thank you, Shyam. Am I audible clearly?
Yes, yes.
Hello. Okay. Thank you. So, hi everyone. So, first of all, thank you for giving me this platform. And I'm joining through my mobile internet because we have some issues with electricity and light. So, somewhere if you think I'm not audible to you, Shyam, I would request to directly call me on my phone so I would be knowing that I'm
Hmm.
disconnected. Sure. Okay.
Yeah, sure. I'll do that. Yeah.
So I'll try to discuss what we are doing and why we are doing within 30 minutes. And I would like to hear from you what you are thinking about this and what are your observations around it. So, as Syam has already mentioned, what we are doing is completely not purely health intervention, but we call it social engineering or social intervention. Everything is a health, ultimately, we all know that. So what we are doing and how we are doing, that definitely I'll discuss. But before that, I think it is important to discuss with you why we are doing it. So I would like to take initial 10 minutes to describe the why part, because I think it is applicable everywhere, but still I think people are not discussing about it. So I'll share the why part, what and how may be applicable to our setting. Uh, Everyone can figure out there how to solve this problem and what need to be done. So I'm sharing my PPT. Don't worry, it's not academic PPT. Is it visible?
Yes, it is visible.
Great. Yeah. So somewhere I would like to know your options so you can unmute your mic and you can speak. And if it is you are not comfortable with that, you can also write down in your chat box. I know I've been told that English is going to be the language of today's discussion, and that's why I'm talking in English. Otherwise, I can understand Hindi, Gujarati, and Marathi. So if any one of you want to speak in any of this language, I would be able to understand. Uh, so if I ask you a question, because we are working with the community, what would be your answer? Is the population explosion is a reality for India or not? So whether it is yes, no, or don't know. Anyone would like to give a
Yes,
response?
yes, it is. Yes, yes.
Okay. Okay. Um, Most of you may have started to think about it, but most of time the common response we get is a yes, and I disagree with yes, because population explosion is in a demography is a future term, which means is India is going to face population explosion, which means overpopulation. Answer is no, because India has already achieved replacement level fertility rate, which means currently 2%, one couple is producing 1.9 children. In a simpler term, 200 children, 200 persons are producing 190 new people, which is lesser than they are. So we are replacing our population. We are overpopulated, maybe yes. Are we on the right track? Yes. So we are not in population explosion track. We have already controlled our fertility. So why I'm saying this, because still that idea that India has need fertility control. So our focus is so much on the fertility, contraception, and so on, which is very important. But we are working for it since 1952. So this is a video. Let me show you this graph if you are not familiar with demography. So we call it population pyramid. So this axis is shows the age band, and this axis shows your percentage of population, which means if you see the longer bar, which means this particular population is more. If you see the shorter bar, which means that particular age group is lesser in the population. So India used to look like this in 1950, where the younger population was very high in our population percentage wise. So these are the age band 0 to 5, 5 to 9, 10 to 15. But if you go on the top, which is the elderly population, we call more than 60 plus. So they are very tiny part of our population. This is a video. You can see how India's population pyramid is changing. So you can look into here and you can look at the shape of the pyramid. Broader the pyramid, which means that particular age group is more. Shorter the pyramid, which means that particular age group is lesser in the community. So you can focus on the year and the shape of the pyramid. So I'm starting the video. Okay. So you got a very quick video of population pyramid. What did you notice into it? What is different than 1950s and what is different now? Would anyone like to share that what the changes we have observed?
Number of elderly people are increasing.
Right. So, yes. So I know I'm giving very lesser time to respond, but uh, because I think, yes, you rightly mentioned that the base is shrinking, which younger population is reducing in size, and the age population, the older population is increasing in the size. So with this, if you can see this graph in entire world, it is happening that those who are age 65 plus is increasing like anything, proportion wise, and less than 5 years is decreasing like anything. So entire world is aging. Entire world is aging, and India is not an exception. So you can see the proportion of elderly in 1950 it used to be 5% of total population. In 2000 it becomes nearly 6 7. In 2011 last census is about 8%. But in 2021 you will find more than 10% of population is elderly, which means out of 10 you will find at least one person who is elderly. So as Shyam mentioned, I work in Wardha, which is a very small district in central India near to Nagpur. And as part of my posting, I live in a village. So whenever I visit my nearby villages, I always found elderly population. So luckily, last 5 years, we are doing our own census. We call health and demographic surveillance system. So we have data of our nearby 100 villages where we are working, which is 1 lakh population. And when we see the population, can you imagine what percentage of population were elderly in our area? It is agricultural community. It is 20% of population is elderly, which means out of 10, two are more than 60 plus, 20% are elderly population, which is more than under 5 population. But majority of our focus is on the under 5 health. Second thing, when we see the statistic, out of this 20%, if I consider this 20% population as my universe now, so out of all elderly, 35% elderly are living alone, which means there is no younger people is living in this house, only elder people is living because their children has migrated outside, because those have a no son, only daughters they used to have, and both the daughters are married. One partner dies, only one male is living. 35% of elderly are living alone. Can you imagine the struggle or inaccessibility they may be facing, not only because of age, but also because of there is no one to support them in their household? So we thought that this problem is very huge and we need to find a solution about this problem. So social science, they say this problem is a solo aging, those who are living alone or empty nesters. And even for those who are living with the family, we found that overall health status of elderly population is not up to the mark. So with this, we thought we need to work something on the aging, and WHO talks about healthy and happy aging. So before that, I would like to give you this scenario. So if you find some person called Rani, 80 years old woman from Bengaluru, and she has posted Instagram reel and she is doing belly dance into the reel. So there could be four type of comments. Uh, would anyone would like to type in a chat box or say what comment you would like to give to Rani? Would request Shyam, if anyone has written something in chat box, please let me know because I'm not able to see the chat box now.
Yeah, there are a few comments in chat box. I'll just tell you. I'm also actually using my phone, so I am not able to.
Any of the participant can also help me because I'm
Yeah,
sharing
yeah.
my. Yeah.
Yeah, so Simran is saying C definitely. Biplab is saying C. Pramod is saying C. Raj is saying C. And Apexa is also saying C.
Okay, great. Thank you everyone for sharing your comments. But I will not say, but this is what you are saying. Wonderful. And I'm glad that you are not part of A and B, but in social media, multiple people will be of part of A and B. Uh, According to me, C is also having a negative stereotype in our mind because we are congratulating Rani because she is dancing in spite of being older person, which means we are assuming that older people cannot dance. So that is coming on base of our stereotypes that older people cannot dance, cannot have fun, cannot have a art, they cannot learn new thing. And these all the stereotypes are combinedly called as a ageism. So this is not very discussed term. It's like any other racism, sexism, casteism. It is ageism. In Hindi, we can say vayovad. So it's very difficult vayovad to understand. In Marathi, we say vayovad, which means you attach certain social conditioning with the age. Because you are age, you can't dance, and someone is dancing. So we are saying that congratulations, you are dancing it. आप इतने बूढ़े हो तो भी आप डांस कर रहे हो, बहुत अच्छी बात है. Again, it is highlighting the stereotypes that we are assuming that 80 plus cannot dance. So similarly, there are multiple scenarios. I'm skipping these scenarios. So this entire thing that we are attaching something with older person is called ageism. And ageism and age stereotype is not old. So there is a novel by Vishnu Sasrao Khandekar in Marathi is on the Yayati. So Yayati is even before Mahabharat. So he was, I think, great grandfather of Pandavas. And this story is wonderful story. So Yayati wants to snatch away his son's youth because he hate being older. And this is wonderful story. Uh, can anyone tell me this photographs shows the story of which uh, historic figure in India?
Is it Buddha?
Yes, so when Buddha was Prince Siddhartha, his parents has been told that please don't show him miseries because he can then take a sannyas and he can leave your kingdom. So their parents try to not to say the miseries of the society. But interestingly, one of the misery was uh, considered as being old. So, how deeply rooted is that being old is fragile, being old is unhealthy, and being old is unattractive, or being old is a misery? So, this is in our history, this is in our everyday thinking that being old is not a good. And not in our just society, but even till 2011, WHO used to give a ICD code. Not old age was not considered as a trigger. Old age itself was considered as a disease. So there was a code called MG2A. So old age was considered as a disease. So there was a huge debate whether we should consider old age as a disease or old age as a period where you can get a disease. And then they withdrawn this code from our literature. Otherwise, it used to have in our literature. So this entire idea brings ageism. So this WHO figures summarize it very nicely. So you have a stereotype in your mind what all people can do and cannot do, which leads to prejudice against them, how we feel about them, which again lead to the discrimination, how you act for them. And these stereotypes can be internalized because when I'm becoming old, I can think I can't dance because I'm old because society has told me this will come in my communication and again institute will reinforce it. How? So again, I'm skipping this video. This is a beautiful video which shows how we think about elderly. For an example, I'm thinking this person may be elderly white hair, so he's struggling with the mobile, but actually maybe he's trying snapshot filters, I don't know. So this video shows various stereotypes, so I'm skipping this video as of now. Also media and agency also try to reinstall this feeling that aging is not beautiful, so they say young and beautiful, which means old and ugly. So this is the anti-aging cream. They don't want you age because age is not beautiful, it is ugly. Any of the newspaper article which will be about elderly, whatever topic would be, they will try to give a very sad and depressed photograph. Or if they are having fun, there should be as per stereotype. Elderly can sit and have fun. They can't play cricket. So you will be seated, you will be playing newspaper, or they will use the photograph where you need physical assistance, or you are very deprived, you are very depressed. Although topic is very different, but the picture which we generally pose is like depressed and unhappy, and that reinstalled in our mind that being older is not a very good thing. Uh, Even there could be hundreds of kahawat idioms that Buddha hoga tera baap. And if I'm riding a bicycle and someone call me a Buddha side mein hat ja, so why I consider being a Buddha as a gali, we need to think about it. If I say someone, hey, young to Harja, so we'll not feel bad about it. But when someone say Buddha to Harja, so we'll feel bad about it. So why it is so bad to being older? There is a kahawat, Buddhi Godi Lal Lagam. So which means if any person who is very old but trying to look young, and if they are trying to make up and trying to dress, then you can sarcastically say that you are Buddhi Godi, but you have done Lal Lagam. So there are multiple things we generally say that routinely that अरे मैं अभी कहाँ डांस करने आऊंगा, अभी मैं बुढ़ा हो गया हूँ. एंड मुझे सुनाई नहीं दे रहा है, शायद मैं बुढ़ा हो गया हूँ, अभी मेरी उम्र हो गई है तो मुझे समझ नहीं आएगा. So we very unconsciously say we associated these all the condition being Buddha. And you may argue that sometimes it is true, being old is fragile, being old is we are not capable to learn. But this is the definition of stereotype, which is overgeneralization. So what does stereotype means? You are overgeneralize it where everyone is, and if anyone is able to do it, they will also not do it because you have generalized it that you can't do it. And this entire thing, ageism, is also affecting our health. So you may argue whether media is teaching us ageism or we are teaching media to ageism. So we never know whether hen came first or egg came first. We can keep debating on that, but that is true that we are not looking at elderly with equal ground as we are looking at the younger age, and we are creating certain barriers and stereotypes for them. And there are certain positive stereotypes also. Elderly are very responsible, elderly are very caring, elderly never fights, which means you are not giving them option to do otherwise. It's like again giving so much of glorification to womanhood that mother can only love their children, which means father can't do it, so mother has to do it. So these positive stereotypes also disabling elderly to live their life at the fully. So even in rural area, we have seen this ageism every day while visiting, while talking to them. So we have a family adoption program. So we go with our students every Saturday with the family members. And most of the students say, sir, in our household only elderlies are living, and they're very depressing. They never listen to us. And every morning when they wake up, they say, Deva, मतलब अब मुझे कब उठा लोगे? When I will die. And I was thinking in psychiatry, we say even slightest willingness to die, we call suicidal ideation and we call urgent call for action. But when our 80% of elderly every day saying that Bhagwan ab mujhe kyun utha lega, so why we are okay with it? And I remember my grandpa when he shifted to Ahmedabad with us uh, from village, and he was 70 years old. And since 70 years to 92 years of his life, for 32 years, every morning I've listened that कि भगवान तू मुझे अब उठा ले अभी जी के क्या करना है. And that is not true, that is not correct, that we are living our 30-40 years of life with waiting to die. So why can't aging be fun, and why can't be aging so important and so equal of any other period of our life? So that stereotype has helped us to think what we can do. So there are certain example in COVID. It was very easily said that if you have only one oxygen, you can give it to young person, don't give it to older person. That is true for that time, but it was so naturally told and never ever debated. So multiple country uh, has published multiple notice which was very ageist in a nature and which was not required also. So I'm going outside of these examples. There was a Shark Tank episode. If you are watching Shark Tank, this person, I'm scrolling my pointer, has uh, explained his brand, and Shark didn't give any of the investment to him, although his brand is profitable, saying that you are too old and you will not listen to us. That was the exact sentence being called by all the Shark, and he was not giving a grant, and he was being said कि आपने अपनी भतीजी को क्यों अपनी मालिक नहीं बना देते, then your company will be highlight, you should not do it. uh, so these lead to elder abuse, more depression in elderly, nutrition problems, and so many things. So now what we are doing, let's come to the solution. So earlier we using term Sahjeevan, we got a WHO grant, and Sahjeevan in Marathi means coexistence. So we thought if we want to improve the living experience of the elderly, so we are not in a domain of palliative care or curative care. Uh, Again, we understand that elderly may have a palliative needs, but we want to create a public health system or a program which is requirement of each and every elderly or every aging person, and we want to break this stereotype at societal level. That was our first objective. And number two, we want to give some platforms for elderly to have a some meaningful life. So during our formative research, we found that the major thing which is missing in life of elderly, which is making them so sad and pessimistic, is that they have lost the purpose of life, because they were economically productive earlier, but now they are not earning anything. And in this such society which is very efficiency oriented, they found we are useless, we are not doing anything. And because of this loss of purpose of life, they are not happy. So we found how can we give a purpose to the elderly, and through society, because India is a very society oriented country. And we found one solution, and we call it intergenerational programming. So we thought, why can't we link two generations, which is culturally acceptable, very low cost, and very productive idea, that we want to link elderly with the younger generation of the village, because not every child has a grandfather and grandmother, and not every grandparent has a grandchildren. So why can't community platforms can be developed where two generations come together, they are benefiting each other, and they are finding purpose in their lives. So our model was very simple. We found 2 to 4 elderly volunteer from every village, and believe me, this particular population group wants a program. They wants to connect with you, and they will never ask you how much money you are going to give me, because they want some purpose in their lives. So we found some few elderlies who are volunteer, physically able, and they can understand the literature. They are literate. So we try to find 2 women and 2 men from each village with help of ASHA worker and our social worker team. So we started the pilot testing with 20 village first. So first we did very intensive formative research that what is the problem that elderly are seeing in their life. And out of this, the key thing was come is purpose of life. So after that, we found 4 volunteers from every village. And now we train these 4 volunteers on specific topics. So that was a alternate month training was being conducted at the PSC level. So training modules was co-developed with the help of the elderly. So our training modules were on the very simple topic. Number one, uh, So I will also tell Marathi as well as English. So Anandi Sandhya card, which
I'm
means
sorry,
happy sun.
Arjun.
Yes,
Hello, Arjun.
yes.
Are you moving your slides or it is just this slide?
No, it
Will
is
I?
there on. It is, I'm not moving this slide.
Okay, okay, sure. Yeah.
So our first module was happy aging. In Marathi, we call Anandi Sandhyakar, which means happy sunset. After that, our second module was on diet. So we were aware of that elderly diet counseling should be very different because they do not have any control over kitchen. उनकी बहू जो बना के देंगी उनको खाना पड़ेगा. So we made our diet module so simple that they can modify their diet without depending on the kitchen through our culturally appropriate recipes and everything. Our third topic was on what to carry when you go to the hospital. It is very simple topic, but because I also practice in tertiary care center once a week, I found so many time elderly forget to bring uh, their cards, their reports, their money, Aadhaar card, everything. So we created a very simple list when you are visiting hospital, what you should carry. Then fourth topic was on making your home very healthy for you. So because the most common cause of fracture or any most common disease in elderly is falls, gir jana. So there was very simple interventions in your bathroom. You should have a one stool, तो उसको पकड़ के आप खड़े हो सकते हो. अगर आपके घर में steps है, so you should have a rope there, so you can take a help of rope. So we found some very simple solutions, and that module was making your home more safer. One topic was on emergency management because many of the elderly are facing diabetes and hypertension. So we have given them few medicines as an emergency medicine. You can keep it in your home and how you can access it whenever you found heart disease, heart attack, or everything. Also, how to make your compliance better because elderly sometimes forgets they may have a dementia and everything. So there are very simple solutions that put your medicines where you are eating your food या जहाँ पे आपकी टीवी है वहां पे कार्ड लगा दो मेडिसिन लेना है तो ऐसे हमने सिंपल सिंपल सॉल्यूशंस वी हैव गिवन टू देम एंड आर ऑल्टायर एक्टिविटीज are all the trainings are activity based. There is no lecture, no PPT, because many of the elderly cannot read, many of the elderly cannot even comprehend the complex things. So we make our training activity based. And the last module, which is based on the early childhood development. So we are teaching elderly how to uh, develop your grandchildren in your community and how to understand your adolescents better. So adolescents life skills and early childhood development. We train elderly for early childhood development. And now they're these master trainers, we call them volunteers or master trainers. So now these four people we identify from every village will go back to their village and they will create a group of elderly and they will talk about this topic once a monthly. So they will meet once a monthly at one place and they will talk about these topics to the other elderly. So now we are working in all the PSCs of Wardha block, which is nearly 100 village and 1 lakh population. And these are the objective which I already said. So these were the pictures of formative research, which is not required. Sorry, I directly borrowed this slide from ICMR presentation. And we also visited few of other NGOs who are working in the similar place. I will talk what they are doing and what we learned from them. And every village we created a group of elderly. So some village they were very unique gender groups. We villagers say we are not compatible with both of the gender, so we were okay with it. Some place we found very large group, existing group for already there, so we joined with this is the Bhajan group. So we already joined with the existing group. This we have newly formed group. This is also in the same village we have a two groups, one male group and one female group. So every village we created a group of elderly. You will find already existing group, and then from this group we identify 2 to 4 volunteers. We call them master trainer, and we train master trainer. And master trainer will go back to this group and they will talk about these topics. And apart from that, we ask this group to arrange certain activities. So in Maharashtra, where we are working, so there is a festival called Pola. It is a cultural festival. Nowadays, people have forgotten it. So they said you used to make bale from clay, bullock and everything from clay. Why don't you do it with your children of your village? This is how we can revive our culture. So we do it in the choraha of the village. The entire village get together and they are teaching their grandchildren how to make a clay. In one village, they said everyone are playing garba. So why can't elderly have a fun? So they had an elderly garba night. Some village they are doing yoga with their grandchildren. Nimbu Chamas they are playing, they are dancing. Here they are teaching the children about some vegetables which is nowadays is very rare. So how to use it and how to do it. So they are teaching the younger generations what we used to do. Uh, a monthly meeting will start with the games. So there are very simple games. So they play the games in their monthly meeting, and then they talk about one of the topic in 2 to 5 minutes in very simple term. Uh, so these are our cascade that master. We train the master trainer, and master trainer go back to the village. They train the group. We call them peer trainer, and this peer trainer will go back to their mohallas, and they will pass this message to all the elderlies who are unable to come to the meeting. And in our entire cascade, we are not giving a single rupee to anyone. So they are all are joining us with volunteerism. And again, good news is that they are searching in an opportunity. They want to join and they want to do some meaningful contribution to the society. During our exercise in 100 village, we found that there are already existing elderly groups are working. So in Wardha, there is a group called Adharwad, which is a group of retired elderly persons. Although they haven't articulated it in their objective, but exactly what they were doing is finding a purpose in their life. So we contacted them and we said, "Oh, we are also working with elderly. Why don't you join us?" And they join us like anything. So they help us to create our modules. They help us to simplify our trainings, and moreover it most of the training we keep them on the stage, because when elderly take a training of elderly it becomes more accessible rather than young people is taking training of elderly. So we had partnership with the local NGO called Adharwad, and when we did some study in other districts, so we found every district has retired persons group, and I think they are very ready to join with us because they already have completed their jobs and everything, so they are free. Number one, most of the time they do not expect any economic advantage from us, and when it is talk about elderly well-being, they are most of time enthusiastic to join. So we had a fantastic experience and we are working together. And slowly we found that our health system is very ageist in nature. So uh, we talk about sensitivity about every other class, but we hardly talk about sensitivity towards elderly population. So during our training of ASHA and CHO, they admitted that we used to say that to elderly कि अरे pain हो रहा है, that's fine, age हो गई है तो pain तो होगा ही ना. So we say, is it a correct way to address our patient just because they have age? Whether these symptoms becomes less important to us. So like we talk about, and they said very. So that was very wonderful training. Sometimes emotional that yes, we are not treating our elderly with respect, and we make them to think about it why it is so. uh, so this is how our monthly trainings look like. They sit together and they talk about some topics. And in some of the villages, so nearly 22 village out of 100, they found this idea so well. We never provide even a tea in the meeting because we were very clear that the chai nasta should not be a center point of our meeting. Ideas should be center point of meeting. So we never provide tea, snacks, anything in our meeting. In 22 village, they find this idea so well, even without our consent. I'm using this word, our help. They made this meeting weekly meeting. So they are meeting every weekly by themselves, and they are dancing, they are playing, they are doing whatever they like, and they invite us. If you want to see us what we are doing, you can come. So we are so happy because they own this idea completely. In one of the village called Mandwa, they have started a story club also. So they are telling the story to the younger children. They're also using one empty space in the village as a Sanskar Kendra. So they are doing certain activities. So in between, they did an activity where most elderly person of the village will tell the history of village to the small children of the village. So they are telling the story. We call it oral history sessions. उन्होंने जीवन गाथा बोला था. So they told कि हमारा village पहले कैसा दिखता था, यहाँ पे क्या था, and that was so fascinating to watch. And we use more of the pictures. Sorry, I forget about one more module. So our one more module is based on the dementia prevention. So the most important activity to prevent the dementia or to maintain mental health is that providing them some constant activities. So we in our last module we tell them you need to keep your brain active. So we suggest them some simple activities, some games that you should always do the games. We also revive the cultural games. So जैसे महाराष्ट्र में they play Ludo, something like this, and we promote it. You please keep on playing Ludo, which will keep your brain active, which will prevent your dementia. So these are some of the quotes from the health system attendings. These are multiple pictures that I'm just throwing in front of you. Uh, we are also creating awareness through social media. However, our reach is very limited. We are going to college to spread this word what ageism means. So we have covered nearly 35 colleges in our area, having a one-day workshop on the ageism and make them think about age stereotype. And the last thing what we are doing in every winter is doing the melavas. Melavas in Marathi, in Hindi, matlab in English you can say fair. So this is the, I will say USP or a department. So we have learned this. To create a community norm, you need to do a large event. So larger village with help of community resources, we do 1 day melavas. So we will having a multiple stalls. Many times school people will help us to, or sometime our project staff. In every stall there will be a game, but there will be a message. So you can see we have created games using the caps of thumbs up and Fanta bottles. Very simple, disposable glass, and elderly are throwing the balls. And this is the corner of paint the painting. So there will be very simple paintings will be there, and elderly will come and they will paint it. And we invite school children also. So sometimes school children and elderly both come together and they play together. So these are the again some pictures. We have find out very simple exercise module. So you can sit on the chair, self-explanatory, see it and do the exercise. So we also give leaflet to the elderly, do it every day to your home. Selfie corner, come with your grandpa and grandfathers, take a selfie together. Again, child and grandfather coming together. This is a tree of your aging. What do you want to be when you become older? So they will write your aspiration there. Diet, some rallies also. So these are the things. So these are some quotes for the Melava. They found it very fun and very interactive, and also the challenging the current norm of the society. We are also trying to reach to the newspaper. Just the dialogue should continue. So we are keep writing something what we are doing, why we are doing in local newspaper to create an awareness. Uh, so many times currently also at this point of time nearly 20 villages we are doing melavas, and most of the time elderly comes and says that this is the first time that we have pick a brush or a color in our life after 30-40 years, and it is so refreshing. So even in these grandmothers, cute grandmothers, many of them are not unable to sit on the ground, but it is so fascinating for them to do a color. And they don't do it for one pictures. I mean, if I remember, this grandma is doing even 8 picture to color it. They find it so interesting. So we are trying to find out certain activities, certain reasons to this you can say also club or this gut or that group to be active. They so our purpose is that they should unite together, they should meet with each other, so this create a safe space for them. They should help each other, they should be taught a self-care, and this group can interact with the younger person with the purpose. And this is how we can improve our intergenerational dialogue and the purpose of life, which will make aging happy and healthy. So these are our enter ideas. Some again features what we are doing and how we are doing. And this is what we are doing in 100 villages of now. Uh, will you say what are evidence do we have? We are generating evidence as of now. We are in middle of our research. It is implementation research. But I will say, do we really need a evidence that having a dialogue with our fellow people will definitely help us our mental health? Although research demand that क्या percentage improve बताओ quality of life में, I found it useless. We don't require any effectiveness evidence whether people are talking to each other and coming together will helpful or not. Whether this idea of forming group and meeting monthly and educating them is effective and doable or not, definitely it is implementation research. So they are doing whether it is feasible or not. So although it is yet to be complete entire research, but I found it is very feasible and can be done with very minimal resource initially, and it can be sustainable with the community resources itself. So that's all from my side. I would like to hear it from.
Thank you, Arjun. It was a beautiful presentation, I would say, especially the concept of ageism. No? What did you say? Ageism, stereotype about aging. I think that is something which we use it in our practice so subconsciously, I would say, which I think we will be conscious about now. And the field activities and the way you have engaged with them, it is really nice. So I think now we have time for a discussion. Before I invite others, I have one quick question for you. You said that you engage ASHA workers and CHOs also in this program. So I just wanted to know that to what extent are they engaged in the actual implementation of the program, the meetings and the fairs and everything, and how could you manage that thing? Because generally that there is that impression that the government system may not be willing to take up such things because they are so occupied with their own bureaucracies, their targets, and their deliverables related to immunization and all those things. So you can just share in brief about that. Yeah.
So I'll try to answer it in very brief. So our idea was that CHO will mentor this group because in Ayushman Bharat guideline, there is a guideline called Sanjeevani, which is recently released. And Sanjeevani says that every CHO has to form a Sanjeevani groups in a villages, and Sanjeevani groups are the older people villages. So based on that, we pitch that idea to our district health system. This is not we are saying, this is your guideline is saying. We are helping you to do it actually on the field. So that was our pitch to the district health system. So we had visualized that CHO will help us to take a training and ASHA will help us to form a group. We completely failed to engage CHOs. Two reasons. Number one, in our district, we have only 30% CHO against what the posts are sanctioned. So that is number one reason. And number two, I found that our most of the activities are happening in the evening and they are doing very time bound jobs. So we couldn't engage CHO and we are also exploring the way. For ASHA, surprisingly, we found ASHA is very interested in this idea because they are also entering into this age. So they said very first time someone is talking about of our age. So हमने start ही ऐसा किया था कि we are preparing you for your future. So how are you
Mm.
looking कि आपका 60 plus कैसे जाने वाला है? So Asha and Anganwadi has taken up nicely. So what we did with Anganwadi, हमने सिर्फ आंगनबाड़ी को इतना ही बोला कि you did not to do anything new, but जब आप अपनी home visit के लिए जाते हो, तो सिर्फ parents को मत बुलाओ, दादा दादी को भी बुलाओ. That's the only sentence we call. कि आप सिर्फ दादा दादी को भी साथ में बिठाओ. कुछ आंगनवाड़ी ने सच में ये करना स्टार्ट किया और जितना भी एंगेजमेंट हुआ होगा. आशा का मीटिंग में काफी एनरोलमेंट रहा, बट ऑल्सो लेट मी कन्फेस दैट वी आर प्रोवाइडिंग इंसेंटिव टू आशा because DHO system का था कि you can't tell Asha to do anything without incentive, and we were also learning that कि even our program will be scaled. Government can provide a 100 rupees incentive per month, which is not a big task. So we are providing incentive to Asha for monthly meeting. We were fearful that कि आशा वर्कर सिर्फ फोटोग्राफ्स लेके भेज देंगे हमें, जो 20% आशा वर्कर अभी भी कर रहे हैं. बट द गुड थिंग इज दैट 80% विलेज में आशा का रोल बहुत मिनिमल रह चुका है. वो जाती है बट एवरीथिंग इज गवर्न बाय द एल्डरली. And because she is also elderly, we found that they are more sincere with the meetings. And meetings are very simple: go and play and do a bhajan. So they don't find it as like a meeting. So yes, आशाज एंगे CHOs we completely fail. What we could achieve, yes, हमने CHO को एजिज्म अच्छे से पढ़ा दिया और बहुत सारे CHOs हमें टेस्टोमनी देते हैं कि yes, now we are mindful in our language. एक दो CHOs है जो हमारी मीटिंग में आते हैं, बट मैं एक्सेप्शन को जनरलाइज नहीं करना चाहता. लार्जली CHOs ने कंट्रीब्यूट कुछ नहीं किया. वो हमारे मेलावे में आके फोटोज लेते हैं और उनकी एक्टिविटी के अपलोड करते हैं. यस, दैट दे आर डूइंग. बट एक चीज करते हैं कि वो हमारे मेलावा में उनका स्टॉल लगाते हैं बीपी का, शुगर का. जब हमारी मीटिंग होती है तब आके वो बीपी शुगर चेक करके चले जाते हैं. सो इतना वो उनका काम का कर रहे हैं. बट अभी हमें सुनने में आया है कि एनएचएम इज आस्किंग देम मोर एंड मोर ऑफ एल्डरली मीटिंग. इफ ऊपर से प्रेशर आएगा तो शायद वो हमारी मीटिंग में मोर रेगुलर आ सकते हैं.
ठीक है. सो ये मीटिंग अभी अभी आप करते हो तो आपकी टीम करती है या आशा वर्कर्स गवर्नमेंट सिस्टम फैसिलिटेट करती है अभी?
हमारी टीम नहीं जाती क्योंकि हम हमारी टीम इज ओनली ऑफ 6 people एंड वी हैव 100 विलेज. सो हमने
हम्म.
जानबूझ के हमारी टीम छोटी रखी है. तो ये आशा प्योरली आशा करती है. हमारी टीम बीच बीच
हम्म.
में कभी चली जाती है जस्ट टू अंडरस्टैंड द टीम. तो आशा इन गाँव के मास्टर ट्रेनर जो हम बोलते हैं वो दोनों की रिस्पॉन्सिबिलिटी है मीटिंग.
ओके. यस. ठीक है. ठीक है. एनीवन एल्स वुड लाइक टू कमेंट, क्वेश्चन, एनीथिंग?
Hello.
यस राज. यस.
Hello. Yeah, yeah.
यस, गो अहेड. या.
Yeah. हमारे साथ ना हमारे इधर से ग्वारी में एक इंटर्न भी काम कर रही है, which is also she is also working on elderly. उसका टॉपिक ही है उसके डिसर्टेशन का. So उसके कुछ क्वेश्चन है तो yeah.
So, hi all. My name is Malvika. Thank you for this presentation. So, my doubt was like even going to the field. One doubt is like how to we engage or actively call the elderly population, mainly at the tribal areas. So, how do we gather them for these events or make the self-help groups?
Okay, so So again, they are. I can share my experience. So because your context is different. So how we did with what principles. So again, it is not self-help group. So there is, if you are saying self-help group in terms of saving money and taking loans, so it is just a group, not that financial microcredit self-help group. So because we spent a 6 month period, a very long period to understand what excites them. So we did free listing exercise, what you want to do in your free time. We did seasonal calendar, daily calendar. So we spent lots of time to understand the elderly community. Although I'm living in this area for 7 years, but we have never worked, and my department is here for more than 60 years, but we never worked with elderly. So we definitely had a very long time to understand their needs first, and we try to find out what is already happening there rather than creating something new. So we did not shy away to join the बिहार में जो बुद्ध क्लब चलते हैं उनको हमने ज्वाइन कर लिया, भजन मंडल को ज्वाइन कर लिया. सो वी ट्राई टू फाइंड आउट व्हाट इज एग्जैक्टली इज देयर. तो हमने वहाँ पे एंट्री ले ली और हमारा आइडिया वहाँ पे प्लॉट किया. Somewhere else we find what is culturally more acceptable and what is exciting them. So staying with them for few months will definitely give us some ideas where we can do it. Then calling them every month is like that. uh, if your activity is exciting them, they will gather every time. I think rather than we call them, they will gather it. So most of the time we couldn't find a problem because they are largely free. Maybe in your tribal area they must be busy in some of the occupations, so maybe their preferred time would be in the evening. But we never started with the PPT heavy topics. Uh, we try to build non-hierarchical training structure that we all do and we all understand. That I'm not emphasizing on that, and we keep it very fun and very engaging. So most of time हमारी मीटिंग में आके वो बोलते हैं कि we have never played like this. So we always play, and this play slowly then we insert our health topics, not from very beginning. So making it more engaging, interesting, culturally appropriate could be the thing which has helped us.
Okay.
Hello, Arjun. I have a question. Was like what was the age group that you enroll in this program? Is it always 60 plus, or there are certain boundaries?
So earlier in WHO 3-year project 2021 to 22, we are with an idea 60 plus. But then we found that our field staff has informed us that 40 to 60 age band is also interested. Then we make it everyone and anyone can join our group. So even under some of the group, adolescents are also coming and it is more welcome. Uh, so why 40 to 60? Because we found that most of the time 60 plus elderly in our area, it is predominantly agriculture. Those are healthy, are largely going to the fields. And those who are free are not able to come to our training at larger training. So we found we can identify volunteers from 40 to 60 और वो long term तक भी trainer रहेंगे. So now our many of the trainers are belong to 40 to 60 and they are being a part of our LLD group. So now there is no age band. Anyone and everyone can come because aging is concerning everyone. So yes.
Thank you.
एक और चीज भी मुझे भी ये पूछनी थी. सो मैंने भी जो स्टडी किया था वो एल्डरली माल न्यूट्रिशन पे था. सो उसमें फाइंडिंग्स ऐसा है कि जैसे लोनलीनेस एंड डिप्रेशन मतलब हाईली एसोसिएटेड है माल न्यूट्रिशन के साथ. और उसके रिगार्डिंग हम लोग यहाँ संगवारी में छत्तीसगढ़ में जो हमारा ट्राइबल एरिया है वहां पर प्रोग्राम भी डेवलप करने का सोच रहे थे. बट हमारे लिए मेन चैलेंज यही आ रहा है कि जो गांव के लोग हैं यहाँ के ट्राइबल एरिया के, तो उनमें आपस में ही वो बात करने का वो एक चीज उनके कल्चर में ही नहीं है. तो वो बहुत कम बात करने वाले, बहुत ही कम रिस्पॉन्स करने वाले वैसे लोग हैं. तो उनको इकट्ठा करना, देन उनको मोबिलाइज करना बहुत टफ रह रहा है. सो आपके एक्सपीरियंस के हिसाब से आप कुछ इस पे बताना चाहे तो.
So I completely agree. Thank you for putting this point. So मैं ये बात जो बताना भूल गया था, हमने दो एनजीओ विजिट की थी. एक चंद्रपुर में थी. तो उनका कंसेप्ट ऐसा था कि वो मायची सावली करते थे, मतलब एल्डरली की स्कूल. सो एवरी 2 घंटा दोपहर में एल्डरली की स्कूल होंगे. तो इतना अच्छा पिक्चर था. सब एल्डरली अपना टिफिन बॉक्स लेके वो जगह पे जाएंगे, 2 घंटे वहाँ जाएंगे. उनका पूरा स्केड्यूल था कि पहले जाएंगे वो, फिर उनका वो पीटी की कसरत होंगी, फिर वो एक गेम खेलेंगे, फिर प्रेयर करेंगे और फिर घर जाएंगे और उनको होमवर्क भी मिलता था. सो देर इज वर्किंग वेरी वेल इन चंद्रपुर. तो हमने उनको विजिट किया था. हमने उदयपुर में गए थे, अर्थ में गए थे, जो डॉक्टर सरंग आयंगर सर का जो एनजीओ है, दे आर ऑल्सो वर्किंग ऑन एल्डरली केयर. तो जब हम वहाँ पे गए तब हमें समझ आया कि जो कंटेक्स में हम काम कर रहे हैं, हमारा सोशल फ्रेमवर्क थोड़ा अलग है, विच इज हेल्पिंग अस टू वर्क ऑन दिस आइडिया। तो आप जो बता रहे थे उदयपुर में ऐसा ही था कि उनके कल्चर में कभी भी स्त्री और पुरुष साथ में नहीं बैठते, एंड वहाँ पे ओपन कास्ट एंड रिजर्व कास्ट भी कभी साथ में नहीं बैठती। वहाँ पे बहुत सारे बैरियर्स है और उनके घर भी काफी दूर है। तो उन्होंने बोला कि हमारे कल्चर में ही साथ में बैठना नहीं है। सो टू बी वेरी फ्रैंक, आई डोंट हैव एनी आइडिया, बिकॉज माई कंटेक्स, हमारी जो सोसाइटी यहाँ पे है, वो लोग काफी साथ में बैठने के कल्चर से आते हैं, गांव काफी नजदीक रहते हैं, और ये फिजिकल हार्ड टू रीच एरियाज नहीं है। सो मतलब आई अंडरस्टैंड कि ये मॉडल जनरलाइजेबल नहीं होगा, एंड आई नेवर वर्कड इन सच कंटेक्स, तो मुझे नहीं पता कि वहाँ पे क्या चीज़ उनको अट्रैक्ट कर सकती है। एक चीज़ मैं बोलना चाहूंगा कि एनीथिंग विच कीप देम एंगेज्ड will work. Now what? That would be definitely context to that area. So I don't know in that such areas what will work. Uh, I have no experience with this.
So, one other question I had, Arjun. You said that you had master trainers in the age group of 40 to 60 years whom used to bring them and train them, and then they used to go back and facilitate the meeting. So you said that there was no incentive, financial incentive for that. But what do you think worked for them? Like, what was their driving force to do this, to participate? And one other important question is that how did you select such people who would, in a village, how did you identify people who would be willing to come for this thing?
Thank you. So the process of identification was very simple. That we did participatory learning action tool. We used that. So in PLA tools only. So we called for the seasonal calendar mapping and everything. So sometimes we observe some were very active and very simple. We go to the आशाज हाउस and we ask कि आपके गांव में कौन से ऐसे वृद्ध व्यक्ति है जो इंटरेस्टेड रहते हैं ऐसी चीज़ों में, जो थोड़ा पढ़ पाते हैं और बाहर जा पाएंगे। तो आशा ने मोस्ट ऑफ द टाइम बहुत अच्छे से हमें नाम दे दिए। उनके घर
Mm-hmm.
जाके हमने थोड़ा आइडिया दिया, तो उन मोस्ट ऑफ लोगों ने एग्री किया। डेफिनेटली ये कोहोर्ट बहुत डायनेमिक है। तो जो हमारे मास्टर ट्रेनर 3 साल पहले थे, जो WHO प्रोजेक्ट के जो 20 गांव है उसके आज 5वां साल हो रहा है, तो काफी सारे चेंज हो गए क्योंकि कोई बीमार पड़ गए, किसी की एबिलिटी कम हो गई मीटिंग में आने की। तो ये डायनेमिक कोहोर्ट है, यस। व्हाट मोटिवेटेड देम? सो मोस्ट कॉमन सेंटेंस आई थिंक एवरी डे वी लिसन टू द विलेज के बुजुर्ग के लिए किसी ने बात नहीं की। यू आर द फर्स्ट वन जो आके बुजुर्ग के बारे में बात कर रहे हैं। तो एक इनके आइडिया बहुत ही अच्छा लग रहा है कि आप ज्येष्ठ नागरिक की बात कर रहे हो, मराठी में उसको ज्येष्ठ नागरिक बोलते हैं, आप वृद्ध लोगों की बात कर रहे हो। और दूसरा, जो इन्फ्लुएंसर लोग हैं वो सब ये एज ग्रुप के नजदीक के ही है, तो उनको लग रहा है कि हमारी बात कर रहे हैं, तो दैट इज हेल्प देम अ लॉट कि हमारी बात हो रही है, हम भी बूढ़े होने वाले हैं। आशा भी उस एज ग्रुप के नजदीक है, आंगनवाड़ी भी उस एज ग्रुप के नजदीक है, सरपंच भी मोस्ट ऑफ टाइम उस एज ग्रुप के नजदीक है। तो इन्फ्लुएंसर पर्सन को वो कनेक्ट करता है। और हमने भी थोड़े ऐसे पीच मारने वाली स्पीच बना के रखी है, कुछ आइडियाज, कुछ बिकॉज आप कितने एजिस्ट हो, हम कैसे ये वर्ड बोलते हैं, एंड हमारी संस्कृति में रिस्पेक्ट इज ऑलरेडी देयर, तो ये बहुत डिफिकल्ट नहीं होता है उनको समझना। तो जो ओल्डर पर्सन, जो टीचर्स थे, जो आशा थे, सब लोग कनेक्ट कर गए कि नहीं ये तो हमारी संस्कृति है कि हमें साथ में रहना था, अभी हम नहीं रहे। तो आइडिया समझाने में टाइम नहीं गया। एंड वन मोर पॉइंट के, अब फिर से मैं बोल रहा हूँ कि बहुत बार एल्डरली जो हमारी सोसाइटी में है वो वैसे इकोनॉमिकली फ्री है थोड़े, तो वो तुरंत ज्वाइन हो गए इस चीज़ में, तो उन्होंने बहुत एक्सपेक्ट भी नहीं किया।
Okay.
हमारा इनिशियल आइडिया ऐसा था कि हम गांव में रिटायर्ड टीचर को ढूंढेंगे और रिटायर्ड सरपंच को ढूंढेंगे जो ऑलरेडी ट्रेनिंग से समझते हैं। बट तब फिर हमें रियलाइज हुआ कि कोई रिटायर्ड गवर्नमेंट एम्प्लॉय इस गांव में नहीं रुकते हैं, तो हमें कोई गांव में कोई रिटायर्ड गवर्नमेंट एम्प्लॉय मिले ही नहीं। देन वी
Mm-hmm.
हैड टू गो अहेड विद दी जिनके लिए ट्रेनिंग नहीं है, तो ये हमें बहुत मुश्किल हुई। शायद मतलब हम अडोलेसेंट्स की ट्रेनिंग बहुत लेते हैं, महिला की लेते हैं, तो हम बहुत बार ऐसा प्राउड भी फील करते हैं कि हम बहुत इंटरेस्टिंग ट्रेनिंग लेते हैं। बट जब एलएलई की पहली ट्रेनिंग हुई थी, यू कांट इमेजिन, 3 लोगों को सुनाई नहीं दे रहा है, 3 लोगों को दिखाई नहीं दे रहा है, 3 लोग
Mm-hmm.
पड़े हुए नहीं है, 3 लोग नीचे नहीं बैठ सकते। तो ऐसी एक भी गेम नहीं थी जिसमें सब पार्टिसिपेट ले पाए। एंड उनको
Mm-hmm.
हम पहले जब ट्रेनिंग लेते थे तो हम कहीं पे भी ले लेते थे। एलएलई की ट्रेनिंग में हमें सबसे पहले देखना पड़ता है वॉशरूम है कि नहीं, क्योंकि उनको
Mm-hmm.
वॉशरूम की रिक्वायरमेंट रहती है। इट्स ए वेरी डिफरेंट ग्रुप। तो हमारा भी काफी सारा रीट्रेनिंग हुआ कि एलएलई की ट्रेनिंग को और कैसे सिंप्लीफाई करें, तब हमें आधार वर्ड ने हेल्प किया। क्योंकि वो खुद एल्डरली थे ना, तो वो स्केड्यूल ही ऐसे बनाते थे कि एकदम आराम वाला हो, छोटे छोटे सेशंस हो, बीच में ब्रेक ज़्यादा हो। तो डिफिकल्ट, सॉरी, डिफरेंट ग्रुप है, जो हम डिफिकल्ट नहीं बोलना चाहिए, जो हम जनरली करते हैं उससे। यस।
Okay. Thanks.
हेलो।
Anybody? Any other comments? Yeah.
हेलो। हाँ अर्जुन सर, एक वो डाउट था कि जैसे लाइक वी आर डूइंग ये इलाइट प्रोग्राम की एल्डरली पीपल आएंगे, मिलेंगे, बात करेंगे और कुछ इंगेजिंग एक्टिविटी करेंगे, डायलॉग करेंगे आपस में। तो जैसे आरएसएस वाला जो मॉडल है, उसमें अगर पॉलिटिकल और वो रिलीजन वाला आइडियोलॉजी हटा दे, तो वो जो उनका संघ का मीटिंग जो करते हैं, वो शायद एवरीडे कुछ गेम्स खेलता है, कुछ एक्टिविटी करता है, तो वो लगभग ऐसा ही कुछ मॉडल है क्या?
So I don't exactly know in the detail, but again to simplify your question, any activity जहाँ पे aging population साथ में आती है and they are doing some contributory thing irrespective of any ideology, I consider as a beautiful thing to continue. जब हम ये काम करते थे ना, तो गांव में काफी सारे लोग ऐसा बोलते थे कि ये बूढ़े लोग देखो चौराहे पे वो जो लूडो जैसा गेम है उसको चौसष्ट बोलते हैं यहाँ पे, पूरा दिन खेलते रहते हैं, कुछ काम ही नहीं है उनको। तो अर्लियर में भी ये डायलॉग बोलता था जब फिल्म, बस ये लोग बैठे हैं गांव के सीसीटीवी है, कुछ करते नहीं है। बट देन आई फाउंड दैट इट इज देयर रिक्वायरमेंट टू बी एक्टिव, एंड नाउ आई प्रमोट दिस गेम। सो एनीथिंग विच कीप्स देम एंगेज, ऑल्दो डेफिनेटली ये एंगेजमेंट का जो टॉपिक होगा वो प्रोडक्टिव होने वाला है, नॉन हार्मफुल होना चाहिए। हम सबकी डेफिनेशन अलग होंगी, बट हाउ कैन वी मेंटेन दिस ग्रुप्स जहाँ पे डायलॉग। नाउ जब भजन ग्रुप तो ऑलरेडी चल रहे थे, यू कुड ऑल्सो आस्क मी कि हमने जब भजन ग्रुप ज्वाइन किया, द ओनली डिफरेंस इज दैट नाउ देर इज अ डायलॉग, देर इज अ लैंग्वेज ऑफ केयर के हमारी वो लेडी अभी नहीं आई है आज, तो चलो जाके उनके घर में खबर पूछ के आते हैं। सो दैट वी हैव स्टार्टेड। एंड सी मैंने बिकॉज बहुत ओवरली ये बात की कि वी आर ट्रेनिंग यंगर पीपल हाउ टू टेक केयर ऑफ एल्डरली, बट प्रॉब्लम दोनों साइड है। जब भी हमने गांव में मिक्स ग्रुप वर्क किया, एलएलई को जब भी स्टेज मिला, उनका फर्स्ट स्टेटमेंट ही था कि यंगर जनरेशन एकदम बकवास है, वो पूरा दिन मोबाइल में बैठती है। तो हमें उनको भी बहुत सारा बताना पड़ा कि इट्स नॉट, दिस लैंग्वेज विल नॉट हेल्प अस। तो ये ग्रुप में भी हम ट्राई करते कि लेट्स नॉट अबाउट टॉक अबाउट समवन, लेट्स टॉक अबाउट अ ग्रुप, लेट्स टॉक अबाउट ईच अदर। हम कैसे हेल्दी टॉपिक्स पे बात कर सकते हैं, तो वो एक लार्जर जो है। बाकी मुझे लग रहा है कि इंडिया में अभी आप मुझे पूछो कि कौन सी एजेंसी एलएलई के लिए काम करती है, तो इट इज़ ओनली रिलीजियस एजेंसी, उसके अलावा कोई नहीं करता है। तो रिलीजियन ही है जो उनको एंगेज कर पा रहा है। तो आई शुड नॉट क्रिटिसाइज देम बिकॉज दे आर द ओनली वन हु इज डूइंग इट, whether it is secular or non-secular, that's a different thing, they are at least there. So how can we create a more secular spaces जहाँ पे सब आ पाए and which is larger good, that could be a question. So coming back to a question, if they are coming together having a meaningful conversation through societal resources, what's wrong in that?
Any other questions? Anybody else?
Yeah.
Mm. Okay. Yeah. Okay, I think we are coming towards the closer of this session. Pavitra sir, would you like to comment anything? If he's okay, I think he's not there probably. Okay, thank you, Arjun. It was really nice to hear you and what you have done. I think it is very creative, I would say, if I want to use one word, because using the team of six people and going to this many villages and then creating a resource in the community of the master trainers of the groups and mobilizing. I think it is an area where everybody feels that we need to do something. We should bring the two generations together. But what you have shown is that this is possible and in a very simple and effective way. We are very keen to know more about it. I think I will reach out to you because we have been trying to develop something for this, but we are not able to figure out how. So I think this gives us many ideas. So we'll discuss it again. And I'm sure people who have been here, they will also would like to connect with you. So yeah, so we have been recording your session, this thing. So I hope it is okay for you if we share it with in the common platform. Yeah, thank you, thank you. Okay, so with that, I think let us close this session unless anybody has any pressing, any feedback, any comment, last comment if anybody wants to make. Okay, yeah, okay then. Okay, Arjun,
Last
thank.
word from my side that
Yeah,
every
sure. Yeah.
module and everything which we have developed is easily available. So without any copyright, anyone wants to use it in any of the way, it will be happy. So I'll share the link with the Shyam. You can share with
Mm.
your common group. So anyone wants to use any of our already created module IEC with or without any acknowledgement copyright, you can use it. We would be more happy if you use it. So we'll share it with you, and anyone can get access to it. So I'll share a few links with you.
Yeah, sure. Thank you. Thank you so much. That will be very helpful. Yeah. Okay. And please do keep joining us in this session.